I'm Dr. Katherine Y. Brown. I will be sharing with you on transforming medical education to address the health issues of vulnerable populations through telehealth training. The team who worked on this project include Dr. Katherine Y. Brown, Dr. Jane S. Reuben, Dr. Armando Ramesh, Dr. Asa E. Radix, Dr. Cheryl L. Holder, Dr. Regina S. Offodile, Dr. Paul D. Juarez, and Dr. Patricia Matthews-Juarez. This project is supported in part by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, entitled Academic Units for Primary Care Training and Enhancement, and our grant numbers are listed for your review. The leadership team at the National Center for Medical Education Development and Research include Dr. Irene Sandvold, Project Officer from HRSA, Dr. Patricia Matthews-Juarez, Project Director, Dr. Paul Juarez, Center Director, Dr. Katherine Y. Brown, Director of Communities of Practice and Dissemination, and Dr. Armando Ramesh, Director of Research. Our National Center was created to address the needs of 3 vulnerable populations: persons who are LGBTQ, persons experiencing homelessness, and migrant farm workers. We use a community of practice approach and strategy to translate, develop, and disseminate our research findings. We had 3 communities of practice, 1 for each vulnerable population. Those COPs were divided into 3 subcommittees: research, curriculum development, and manuscripts that included policy briefs. This presentation is around the development and dissemination of research findings that we developed into policy briefs. This is one of the 10 policy briefs. Our policy briefs are intended to provide important data to policymakers and other stakeholders who can inform and influence implementation of laws and policies that will support societal change for vulnerable populations. Our stakeholders included curriculum planners and medical and allied health professional schools, education policymakers in government and advisory bodies, the government, and legislators. This is relevant because healthcare delivery through telehealth is an emerging strategy for providing healthcare for vulnerable populations. We learned that telehealth has not received adequate attention in medical education or residency training, resulting in an ill-prepared workforce. Challenges identified included cultural humility, mobility, language, literacy levels, health literacy, and internet access to healthcare. Once these challenges are addressed, telehealth can be used to achieve health equity in socially vulnerable patients. Our policy options: evaluation of existing information on telehealth training prior to proposing and accepting the existing curricular interventions, and input from stakeholders about the use of telehealth to address the health issues of gender and sexual minorities and other socially vulnerable populations via telehealth before policymaking. For more information about our work, our social media handles are listed. I've listed my personal contact information as well as information from the National Center. Thank you.